Good afternoon, everyone. Bonjour. When others are in need, New Brunswickers just want to help, and it's who we are. During the St. John River floods of 2018 and 2019, people rushed to help their neighbors, filling sandbags and moving possessions to higher ground. They donated food to emergency shelters. They gave of their strength to help those in difficulty. And when we see our fellow New Brunswickers struggling, we want to lend a hand. The COVID-19 pandemic has touched this impulse in us, so we want to help in any way we can. And in recent days, many New Brunswickers have reached out to my office asking how they can help. In particular, they have been moved by the bravery of our frontline workers and our healthcare workers, and they want to protect them, help them protect themselves as they protect us. So we are working to make this happen, and I want everybody to know how much I appreciate their generosity. In a moment, I will provide details on how New Brunswickers can donate personal protective equipment to aid those working in our hospitals, nursing homes, and special care homes. La pandémie de la COVID-19 a réveillé ce sentiment en nous. En effet, nous voulons aider par tous les moyens possibles. Au cours des derniers jours, beaucoup de gens du Nouveau-Brunswick ont contacté le personnel de mon bureau pour demander comment ils peuvent aider. En particulier, ils sont émus par la bravoure de nos travailleurs de la santé de première ligne et ils veulent aider à se protéger comme ils nous aident à nous protéger. Nous nous penchons sur cette question en ce moment. Je veux que vous sachiez tous à quel point nous vous sommes reconnaissants de votre générosité. Dans quelques instants, je vais indiquer comment les gens du Nouveau-Brunswick peuvent faire don d'équipements de protection individuelle pour aider ceux qui travaillent dans nos hôpitaux, nos foyers de soins et nos foyers de soins spéciaux, et aussi les gens qui travaillent dans la communauté. First, I am pleased to report that there have been no new cases of COVID-19 in New Brunswick today. Our total cases to date stands at 116. Our numbers of new infections have been low in recent days, and we are definitely moving in the right direction, but we have not reached our destination. Tout d'abord, j'ai le plaisir de vous annoncer qu'il n'y a aucun nouveau cas de COVID-19 au Nouveau-Brunswick aujourd'hui. À ce jour, le nombre total de cas est toujours 116. Le nombre de nouveaux cas d'infection demeure faible ces derniers jours. Il va sans dire que nous avançons dans la bonne direction. Toutefois, nous ne sommes pas encore arrivés à notre destination. We must maintain our resolve. We can't let up, not even for a minute. Please continue to stay home as much as you possibly can. Keep doing what you're doing. When you do go out, keep your interactions with others brief and maintain 2 meters of physical distance between yourself and others to keep the virus from spreading. Wash your hands regularly and thoroughly. When you do these things, you are denying the virus the opportunity to move through our province, and you are helping to save lives. I know that many of you want to be more actively involved in this fight, and I've heard of people who want to donate protective equipment that they possess. Some have stocks of masks, gowns, and medical equipment they purchased when caring for a loved one at home. Some businesses that use protective gear in their daily work have inquired about donating their stock, and others want to turn their hands to sewing masks or making other gear for our frontline workers. These gestures of generosity touch my heart. Je sais que bon nombre parmi vous souhaitent participer plus activement à cette lutte. Des gens m'ont informé qu'ils veulent faire don de leurs équipements de protection individuels. Certaines personnes ont des stocks de masques, de blouses et d'équipements médicaux qu'ils ont achetés quand ils ont pris soin d'un proche à la maison. Certaines entreprises qui utilisent de l'équipement de protection dans ce cadre de leurs activités quotidiennes ont demandé comme elles peuvent faire don de leur stock. D'autres veulent se consacrer à la couture de masques ou la fabrication d'autres équipements pour nos travailleurs de première ligne. Ces gestes de générosité me touchent de cœur. But it's important that we make sure the protective equipment we use to keep our frontline workers safe is safe for them to use. We have to be certain that this material has not been contaminated in any way. There will be a strict process to vet donated protective gear. Notre personnel chargé de la logistique et de l'approvisionnement travaille sans relâche pendant cette crise pour s'assurer que nos travailleurs de la santé disposent du matériel dont ils ont besoin, là où ils en ont besoin. Ils travaillent 24 heures sur 24, 7 jours sur 7 et jouent un rôle fondamental dans la protection de ceux qui nous protègent tous. L'information sur la façon de faire un don est dorénavant affichée sur le site web du GNB sur le coronavirus. Grâce à un lien sur le site web, vous serez dirigé vers un formulaire à remplir et à soumettre vous permettre de détailler le type de matériel dont vous souhaitez faire don ainsi que son état. De l'information précise sur le fabricant, les spécifications, la certification, le cas échéant est nécessaire pour que nous puissions nous assurer que le matériel peut être utilisé de façon sécuritaire. Our logistics and procurement staff have been working very hard through this crisis to make sure our healthcare workers have the equipment they need when and where they need it. They are working 24/7, playing a vital role in protecting the people who are protecting all of us. So the procurement people at Service Nouveau-Brunswick are playing that role along with our staff and the logistics people. So they're all very, very coordinated. I understand that New Brunswick Medical Society is also part of some of that process. So, and they will have more information on procuring for frontline workers who are in the community. Information on how to donate is now posted on the GNB coronavirus website. Through a link on the site, you will be directed to fill out and submit a form detailing the type and condition of materials you wish to donate. Specific information on manufacturer specifications, certifications, where applicable, is required so that we can be sure that the material is safe for use. If your donation is accepted, specific instructions for delivery will be provided to you. Physical distancing practices will be followed at all times. The desire to help is second nature to New Brunswickers, and all of your efforts are appreciated. Le désir d'aider les autres, c'est un réflexe naturel pour les gens du Nouveau-Brunswick. There is another way you can help in the fight against COVID-19. Stay healthy. Whether it's your mental health or your physical health, we really, really want everybody to take good care of themselves and to take care of others. We have made significant efforts to free up space in our hospitals in anticipation of the surge of COVID-19 patients. It's imperative that we continue to give our healthcare system the ability to care for those in greatest need. By maintaining your own health at this time, you are helping to keep our healthcare system strong. And you are also helping yourself, as we have seen that those who have underlying illnesses have been amongst those most susceptible to this disease. And that's not to say that people who are in completely good health are not affected, but we certainly see a proportionately higher number of people with comorbid conditions affected severely. Prenez soin de vous, mangez sain, faites de l'exercice régulièrement et reposez-vous. Il est essentiel que vous soyez en santé pendant cette pandémie et pendant la reprise qui suivra. C'est en travaillant ensemble et en donnant à nous, nos voisins, que nous avons déjà survécu des moments difficiles, et ce sera de nouveau le cas. Look after yourself by eating healthily, getting regular exercise, and plenty of rest. We need you to be well as we go through this pandemic and for the recovery that will follow. Working together and giving to our neighbors has gotten us through hard times before, and it will again. Thank you very much. Merci.
Good afternoon. Bonjour. As we work together to slow the spread of COVID-19, one of the things we have asked of everyone is to stay home. For most of us, home is our safe place. But it's understandable if you're starting to feel just a little bit restless. C'est des temps difficiles. Nous n'avons jamais vécu de pandémie comme celle-ci. Et il n'y en a pas seulement une façon, ou de bonnes façons d'y réagir. We've been isolating for weeks. Some of you are alone, others with your families. Some are trying to entertain small children, and many of you have been working from home. We are all anxious and unsettled. Cette expérience suscite des sentiments inattendus et des craintes. Alors que la situation se poursuit, alors que nous avons tous assez regardé de télévision pour en être saturés, ou la pile des livres que nous ne pensions jamais lire, c'est normal que vous vous sentiez de plus et plus agité. Those feelings might show up in different ways to different people, but one of the best ways to deal with them is through connection. This isn't something even the most introverted amongst us feeling it's a need at this point to talk to someone, to have exchange. While in-person connection isn't possible, there are many other ways we can reach out to one another. Check on your neighbors. Déposez une note dans leur boîte postale pour leur dire que vous pensez à eux et que vous êtes là s'ils ont besoin de quelque chose. Appelez une personne âgée pour voir comment elle va. Send a note to local seniors' homes. Reach out to local businesses and restaurants. Thank them on social media, or if you can't afford to, make a purchase from them. Many local restaurants are doing takeout, and some small businesses are providing online services. Support them if you're able. If you know a frontline worker, drop a thank you note in their mailbox. The next time you go for groceries, offer to pick up items for someone who can't get out. Préparez un repas pour un ami et laissez-le au pied de sa porte. Avec un autre pour lui rappeler que vous vous réunirez en personne lorsque la pandémie sera finie. Passez un raté sur la pelouse de quelqu'un. Call a friend or family member and take the time to really connect. Do something that helps someone else, and you will feel good at the same time. We are all struggling right now, so finding healthy ways to feel good are important. If you're experiencing intimate partner violence and do not feel safe at home, there are options available to you. Government is working with transition houses and second-stage housing across the province to ensure that services are available and provided in a way that protects everyone involved from COVID-19 infection. Si vous avez besoin de parler à quelqu'un et vous ne savez pas vers où vous tournez, consultez la page dédiée au coronavirus sur le web du gouvernement de Nouveau-Brunswick. Il y a une section consacrée au renseignement et aux services de soutien relatifs à la violence familiale. Il compromet sur la façon dont les victimes, les enfants et les témoins peuvent obtenir de l'aide. If you need assistance dealing with anxiety, depression, and any other mental issues, the coronavirus page is also a good place to start. There you will find numbers for organizations that can help you get through the challenging time, including the Kids Help Phone, the CHIMO Helpline, and Community Addiction and Mental Health Centers. Reach out, connect, and most of all, don't forget to take care of yourself. We can remain physically distant and stay connected to family, friends, and neighbors. In fact, we must do so. One of the many organizations that is making a difference during this pandemic is the Red Cross. L'une des tâches que la Croix-Rouge canadienne a acceptée est la gestion de la prestation de revenus unique visant à aider les gens de Nouveau-Brunswick à faire la transition jusqu'à l'entrée en vigueur du financement fédéral d'urgence. I wanted to update you on that program. To date, more than $30 million has been distributed to over 33,000 New Brunswick workers. We are working through the rest to make sure that all who applied and are eligible will receive this funding. This is money that is helping people across the province at a time when they need it most. As a government, we will continue to find ways to support the people of this province as we face the challenges of COVID-19. Avec l'arrivée de printemps, la pandémie n'est pas la seule préoccupation pour de nombreux Nouveau-Brunswickois. Je veux prendre un moment pour parler aux gens qui vivent le long des rivières et des cours d'eau au Nouveau-Brunswick. We encourage anyone living along waterways to remain vigilant. There was some localized flooding in the Sussex area overnight. Due to Monday's heavy rainfall, the water came up quickly on the Trout Brook in areas around Sussex and Sussex Corner that are prone to flooding. No evacuations were necessary, and water levels have since gone down. Waters are expected to surpass flood stage this week in Gagetown, with the river level showing as at flood level of 4 meters for both Thursday and Friday. Saint-Hilaire will be just below the flood level on Thursday. People should exercise caution as the spring freshet is underway and water is high. Les équipes de l'Organisation de mesures d'urgence de Nouveau-Brunswick et du ministère de l'Environnement et des gouvernements locaux, ainsi que leurs partenaires de l'ensemble de la province, sont toujours attentifs, et ce qui se passe avec la rivière Saint-Jean au printemps. The same is true this year. We can forecast river levels, but ice jamming is always unpredictable. The Emergency Measure Organization and its partners have factored the situation with COVID-19 into their planning. For example, they've examined the requirements of social distancing and protective masks put on sandbagging operations in case that is required. Ils ont étudié la façon dont le travailleur pourra réaliser leurs tâches tout en maintenant la distanciation physique et quelle zone de nettoyage pourra être requis. And in past years, some people have had to evacuate because of flooding. A good number of them would stay with friends or family. This is not an option this year because of the need to observe social distance. So if flooding forces evacuation, the Canadian Red Cross will help provide temporary lodging. If and when this service is needed, registration information will be shared. Pour l'instant, les perspectives sont bonnes, mais nous devrons être prêts. Nous souhaitons tout que ça n'arrive pas, mais je veux vous rassurer que des mesures ont été prises au niveau de la planification et des préparatifs. Government at all levels will continue to work together to address the challenges facing New Brunswick right now, and we will continue to keep you informed. Everything we are doing, we do with the health and safety of New Brunswickers as our primary focus. What I know for sure is that New Brunswickers are resilient and caring, and together we will get through this. And I know it's great news today to hear of no new cases. And you know, I'm hoping the next number of weeks will be boring in that sense and we won't see new cases. But that's unlikely to be the situation. We do feel that the flooding situation is not going to be anywhere near what we've seen in the past 2 years. In fact, we're expecting normal conditions. But that's too early to tell, given the pending ice jams that are a potential. But I know we'll get through this. And right now, boring is what I'm looking for. I'm looking for it to be quiet, peaceful, so that when it comes May and the weather really gets good, we will have a really solid track record that will say, you know what, maybe we can think of doing things differently. And I am looking forward to that as much as you are. Thank you. Merci.
Merci, Monsieur le Premier Ministre. Thank you, Premier. Thank you, Dr. Russell. We will now proceed with questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux journalistes, des questions aux journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, I was speaking with Dr. McDonald this morning from the Institute of Research, Data and Training, and he said that while New Brunswick so far has been useful, our testing so far has been useful in pinpointing people who need to isolate, it hasn't been as effective in terms of understanding how many people have been exposed to the virus and the nature of the disease. And while he recognizes that resources and financial limitations might make testing everyone not feasible, he thinks that a random sampling of population testing could shed a lot of light on disease dynamics and transmission pathways. Now that you're opening up testing a bit more, would you consider testing an entire small community so that researchers have data to better understand the nature of COVID-19?
Yeah, so that's a very good question, and there's a few parts to that. Yes, we have opened up our testing, and so that'll give us a good idea, again, if there's more community transmission that we're just not seeing, although, again, our numbers in hospital and ICU in terms of percentage of transmission, in terms of that proportion and reflection of that, again, keeps us hopeful that perhaps there's not a lot out there. more information is better, obviously, and there are different ways of testing, whether it's random, whether it's in an entire community, whether you're using the current testing regimes or the newer ones that we could see in the future that already are taking place in other jurisdictions around the serological testing and looking at immunity. So all of these things are part of our discussions, actually. So at the national level, we're discussing these things, and we're also discussing them here at the province level. So they're definitely on our radar, and as things evolve, and we are taking those things into consideration as we move forward in terms of looking at different pieces of data that would help us in making decisions around what is actually happening and what we'd like to see moving forward.
Thank you, Doctor. Vicki, do you have a follow-up question?
Yes, thanks, Bruce, and thank you, Dr. Russell. I'd like to also applaud you for setting up a PPE donation site. And with that in mind, do you think it will ever be possible to get staff of long-term care facilities N95 masks to better protect themselves?
So the issue around what PPE to use is completely dependent on what type of medical procedures are being done and the risk associated with those medical procedures. So we actually have new guidance documents around long-term care facilities and PPE and those types of things. So we're having conversations with social development and the task force around operationalizing those pieces. And it is very important to have the appropriate PPE and the appropriate training as well. So that is also part of the conversation. So it's not just about giving somebody PPE, but making sure that they're trained to use it appropriately at the right time for the right types of procedures in the right settings at the right risk level. So those are all conversations that we're having right now. Very, very important.
Thank you, Doctor. Thank you, Vicki. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. We spoke with an infection control epidemiologist today who said New Brunswick could be on the verge of peaking in COVID-19 cases. What is the reaction to this, and do you believe that this is actually the case?
Sorry, who you were speaking with an individual?
From University of Toronto.
Okay. Yeah. So again, we have several epidemiologists on our team, and we have several medical officers and like many parts of our team who look at this data in fine detail. And so definitely, as we've spoken of before, you can't see the peak until after you've passed it. So we're definitely keeping an eye on the numbers. We obviously have a few good, nice news stories the last few days in terms of our numbers being low and the fact that we don't have any new cases today. But in terms of confirming that, we're past the peak, I think we still need to look at probably a few more days and weeks ahead looking back, because you're always looking at a snapshot of 2 weeks behind. So what we're seeing today is as a result of things that happened almost 2 weeks ago with respect to the incubation period. So in an outbreak setting, you're going to need to look at 2 incubation periods to fully realize and understand and make decisions about what the data means and how to analyze it.
Thank you. Elizabeth, do you have a follow-up question today?
Yes, my second question is for the Premier. Paramedics, city works crews, police, and even media sometimes travel inside vehicles together because it's part of their job. Is that okay under the current situation, or is everyone adhering to a one-person per vehicle rule?
The distancing, the social distancing should be practiced for everyone, and that includes anyone riding in vehicles. What we have done as our safety officers have checked on people for that very reason, because it's one thing if you're a family and you're living in the same household and traveling together, but it's quite another if you're coming from all different directions and then joining together in a common vehicle, because that's certainly how the disease can be spread throughout.
Thank you, Elizabeth. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering, with your announcement yesterday about casting a wider net for testing, has 811 heard from more people? And I guess, has 811 been more inundated with calls?
Yeah, so over the weekend, they did have an increased number of calls based on non-COVID related phone calls, but in the last 24 hours or so, we've had almost triple the number of COVID related calls. So we actually have more staff being brought in, just like the last time we had a surge, to deal with that.
Thank you. Laura, do you have a follow-up?
Yeah, very quickly. I couldn't believe I looked back at today 1 month ago, and a lot has changed, obviously. But one thing that was announced around this time was that Horizon Health and Vitality was going to end elective and day surgeries for the time being. But now that we're seeing, I guess, fewer cases, would you recommend hospitals, I guess, start or begin those surgeries again?
I think that right now we have to stay the course, Laura. I think it's good to have those conversations and discussions, but I think we need to be very careful about monitoring the situation right now. I think the borders being closed is really, really helpful because, again, we're seeing a decreased number of the travel-related cases right now, which is very good. And so what we're really, again, trying to get a sense of moving forward in the next 10 to 14 days is around if there is any more extensive community transmission that we need to really worry about. So I think having the hospital capacity being maximized right now has been a really helpful exercise in terms of what can be done moving forward. And so depending on how things shift and change in the next 2 weeks or so, I think it'll be clearer what kind of discussions we need to have around elective surgeries and procedures.
Thank you, Laura. Charles Camiran, TVA Edmundston.
Oui, ma question s'adresse au Premier ministre Blaine Higgs. Avec les derniers jours où on a pu constater qu'il y avait beaucoup de cas qui sont rétablis, est-ce que vous entrevoyez à court terme d'être un peu plus permissif avec les mesures qui ont été mises en place, dans le sens, est-ce que vous entrevoyez peut-être réouvrir tranquillement les entreprises non essentielles au courant des prochains jours, prochaines semaines?
I think that as you've heard from Dr. Russell, the next few weeks are going to be critical, watching a pattern. So if we can get, several days, maybe several weeks, meaning the next 7, 10 days, 14 days of consistent levels of cases or no cases, then that begs the discussion going that far. What do you need to look at for maybe additional testing, or how can you relax some measures? But right now, these next 2 weeks are critical in that regard. And my comments earlier about looking at May and saying, are we going to be able to do something differently in May? I hope so. And I hope, to your point of looking at some of the businesses that previously weren't considered essential, can they find ways to operate and still respect safe distancing practices, but be able to get it back in business? We want to make that happen, and it will depend what it looks like over the next coming weeks. And we are right now looking at how we can restart our economy, how we can allow communities to get back to normal, but we have to do it while at the same time not putting ourselves in harm's way and losing the ground that would seem that we've gained at this point in time.
Thank you, Premier. As-tu un suivi, M. Camiran?
Oui, ce serait un suivi avec Dr. Russell. Pour être bien certain de comprendre, vous voulez quand même, là, c'est important pour vous de resserrer les mesures au courant des prochains jours envers la population, c'est-à-dire de garder toujours des mesures de distanciation sociale. Vous ne serez pas plus permissif là, au courant des prochains jours. C'est bien cela, Mme Russell?
Exactement. Il faut vraiment continuer avec les mesures qui sont en place maintenant.
Merci, M. Camiran. Adam Harris, Telegraph Journal.
Thank you, Bruce. Premier, Prime Minister Justin Trudeau said today that a number of the provinces are looking to give temporary pay raises to employees at long-term care facilities following Quebec's lead. Trudeau said the feds will help provinces pay for the increase and that they're in talks with the provinces. I wanted to know if New Brunswick will do this, why or why not?
Well, certainly, Adam, right now, watching our situation very closely and in comparison with other provinces, We hope that our situation remains normal. We hope that our conditions, our hospitals are about 50 to 60% capacity at this stage. ER activities down by about 50%. So we're actually thinking, is there a way that we can open up some services again, hoping the numbers stay low and stay the way they are and continue to decline, but that'll be kind of in consultations with Dr. Russell as we go forward. So at this stage, it would be, I can understand why Quebec, moved in the direction they did and potentially Ontario. I hope we're not forced into the same situation because of an outbreak that it gets, out of control. So at this point, we want to make sure that people are able to work their normal shifts. They're able to do that and have, a normal as life as possible, knowing that restricted one at home is different. So we're in a little different place than other provinces in that regard. I'd like to think we would be able to stay in that different place because of the lack of urgency.
Adam, do you have a follow-up?
Yes, please. For Dr. Russell, today's zero increase comes after 250 new tests over the last 24 hours. Neighboring Nova Scotia, potentially a comparable for the province, has 43 new cases today, its worst day yet, but they tested more than 1,400 people yesterday. Why the discrepancy in testing? Over 1,200 more tests than neighboring Nova Scotia yesterday. I thought New Brunswick was supposed to be ramping up, and why can't it test at that level?
We absolutely can test at that level. We just haven't had the demand. We have changed our criteria for testing. We have expanded it. We have the resources in place with respect to the 811, family doctors doing virtual care in terms of referrals, and then our testing sites are obviously still able to ramp up capacity. So we would definitely aim for 1,000 per day as needed. I think if you look at a graph that would show New Brunswick cases versus Nova Scotia cases, they are on a different trajectory at the moment than we are, and again, we're holding steady in terms of the low numbers recently, but that can change, and so again, as things change and evolve, we will see changes in along with that with respect to the demand. So, and we as one of the other reporters asked, we are looking at testing some asymptomatic folks in very specific situations, and that's something that's kind of the next phase of our discussions. But right now we have 200 calls in the queue based on the increased volume of calls to 811 in the last 24 hours. So there's 200 people that still need to have callbacks at this point. So again, we are not at complete capacity right now in terms of we do have room to test more people, and we will should that need arise.
Thank you, Doctor. Thank you, Adam. Ben Burnett, CHSJ News.
Thank you, Bruce. Dr. Russell, with the change in testing for lower severity symptoms, I would think that would be kind of difficult to monitor. You mentioned allergy season yesterday as a possible confusing factor. Many are waking up with a sore throat or sinuses for spring morning anyway. Could you kind of clarify at what level you'd expect someone to call 811? Is it the moment you feel an itch in your throat, or would it be after prolonged symptoms?
Well, again, because there's several symptoms to choose from in terms of having 2 of the 5. It's completely up to the patient when they call 811 and how that works. So we have the capacity, we have the resources. So to offer that level of testing right now, I think is a good thing based on where our numbers are at. And again, things can change and evolve. What we're looking at today is a snapshot of what's happened 2 weeks ago. So again, with the 14-day incubation period, we're just going to keep monitoring things.
Thank you. Do you have a follow-up question, Ben?
Thank you, no.
Thank you, Ben. Monsieur Matthew Wacomo, l'Acadie Nouvelle.
Merci. Ma question est pour le Premier ministre Higgs. C'est en lien avec la question de Adam Harris un petit peu plus tôt. Est-ce que le gouvernement provincial a demandé quoi que ce soit au fédéral pour l'aider dans les foyers de soins, que ce soit de l'équipement, de l'argent ou autre chose du genre?
At this point, all requests that come in through any of the, whether it be the nursing home sector, whether it be through the hospitals, Vitalité Horizon, or whether it be in the EMO world, anything that we require, it all comes into one central area within health and kind of the emergency response group. And then that is disseminated into requests as required to the federal government or through our own supplies internally. So I don't get specific requests as such, but I would see the general requests that I would review with my colleagues provincially and with the Prime Minister as or the Deputy Prime Minister. So that's the way any requests, and the same for funding levels, whether it be through health or through the business sector, as we're looking for support. They're all coming in from different areas, and then I take those as we need to supplement them and make federal requests.
Merci. Monsieur Comeau, as-tu un suivi?
Oui, toujours pour le Premier ministre. Donc, si je comprends bien, vous n'avez pas demandé de fonds à Ottawa pour accorder des hausses de salaire temporaires aux travailleurs dans les foyers de soins. Et si ça n'a pas été fait, songez-vous à le faire dans les prochains jours?
Well, at this point, I haven't asked for funds for any sector for increased funding, for individual funding. And it's because our situation has not warranted it, the same as you would see in Quebec or, as I say, in Ontario or BC or many provinces. So I am asking for funding for situations that we have related to here in New Brunswick. And as we go through this, if we find ourselves in situations like other provinces, then we'll do whatever is necessary to work with our employees to make sure that not only are they compensated fairly, but their work conditions are certainly, and their safety equipment that they're wearing is certainly appropriate, and it's available for them as needed. So I base my decisions and our requirements on what our needs are directly, not just because somebody else in another province, asked for it.
Merci, Monsieur Comeau. Monsieur Michel Corriveau, Radio-Canada.
Merci, Bruce. C'est une question pour le Premier ministre, Monsieur Higgs. J'aimerais savoir, la suite d'une question de tout à l'heure, vous avez, si j'ai bien compris, parlé d'un possible changement dans les restrictions au mois de mai, selon la situation. S'il y a un changement dans les restrictions, comment va se faire le redémarrage des entreprises? Comment ça va se passer? Quelles entreprises d'abord, etc. Comment vous envisagez ça?
So certainly right now, we had about 1,400, I think the number might be a little less, requests that went through Navigator and different businesses to understand their scenario. We are currently categorizing them in the sense of, what business could operate under meeting the social distancing and be able to start up in the community, working with public health to determine when would it be possible and feasible to do that. We want to get the economy moving. I'm getting requests from, different businesses that are, I think, starting to, make more of a public statement about, we think we could follow the rules and get back in business. And I think we certainly want to be able to accept that. We need to do it in a very methodical manner so that as we move forward, and it could be any business, as long as they can meet the standards, but the timing has to be right, because we do not want to regress. We don't want to go slip away from what appears to be right now a very good position. So we have to do it in a way that we can ensure we maintain where we are and not have an outbreak. But I'm sympathetic to the businesses, and I'm sympathetic to people that are not able to move around like they used to, because and we've had some pretty interesting emails and messages, as you might imagine, from some of the fishermen and hunters. So it's like I understand it, I get it, and I'm just asking, be patient for another couple weeks. Let's understand the trends that we're going to get here, and then we will have a path forward to allow businesses to get back into shape while following the guidelines necessary to ensure we don't have an outbreak. But we need to get the numbers in over these next couple of weeks. I'd like to clarify something, if I might. It's unrelated to this particular question, but it is related to a comment when I was asked a question about driving together. And I think just to be sure that it was understood, we have a case where we have paramedics, we have healthcare workers, we have daycare workers that are working in close proximity as part of their everyday job. We're asking, obviously, that the right precautions are taken and the right equipment is worn. But this is part of the job, and we accept there are certain risks to that, and we provide the necessary equipment and precautions in doing so. We have LPNs in hospitals. Obviously, we have nurses in hospitals. So I think, when I made the comment and I talked about, we obviously expect that they must continue to do what they're doing, and they're doing an admirable job. And we commend them for that and need them in many ways. We need them, obviously, to get through this. The area comes down, I guess, in sense, because there was also reporters were put into that. And I guess if we had a bus and everyone can say distancing, then there's possibilities to carpool. But what we have to avoid is the common sense item where we see 4 people or so get together in a small car and drive like they used to, and they're all coming from different areas in the community. That's the challenge. It's kind of a common sense thing is how we manage it. Thank you.
Monsieur Corriveau, as-tu un suivi?
Oui, merci. C'est dans le même sens, mais plutôt que de parler des entreprises, maintenant parlons des citoyens. Il y a aussi beaucoup de gens qui se demandent combien de temps ils vont devoir rester comme ça. Quand on voit la situation au Nouveau-Brunswick, les cas qui n'augmentent pas beaucoup, et là vous parlez il faut attendre les 2 prochaines semaines qui sont importantes pour voir quelle sera la situation. À quoi peut-on s'attendre du côté des citoyens? Est-ce qu'ils peuvent s'attendre à un relâchement de certaines restrictions? Comment vous voyez ça pour les prochaines semaines ou mois?
So what I said before in relation to this weekend and people adhering to the rules and seeing what we'd get for results over the coming 2 weeks, that's what we're measuring right now. And to Dr. Russell's comments about, we've seen increased testing requests because the requirements have been relaxed. So we're going to see a lot more tests over the coming days. We'll see what that brings. And then if our situation remains unchanged or essentially unchanged in relation to the number of new cases, then it allows us to then say, okay, what can we do? So let's just say that if everything was to remain as is today over the next 2 weeks, there would be cause for us to look at our situation and say, how can we make some changes to make restrictions reduced? But we need to have that behind us first. And then we can make that decision. And New Brunswickers will know. I mean, it won't be something that it'll be a surprise. If our numbers stay flat and we're able to see that over a 2-week trend, then they will know that they can expect something to happen in May that would help us to work our way back to normal. But recognizing that normal's not going to be what it was last year at this time. And normal will be different. But still, getting ourselves back to a way of life that's acceptable for New Brunswickers and as we want to once again enjoy our province.
Thank you, Premier. Merci, Monsieur Corriveau. Silas Brown, Global TV.
Hi, Dr. Russell. I just want to pick up on this thread about testing that was mentioned earlier. I know that you had said, that the demand isn't there to be doing more than 250 tests, but is there any worry that our numbers here could be artificially low because we haven't been doing the same amount of testing as we've seen in Nova Scotia? Obviously, they're in a different situation on a different trajectory than we are, but is there any possibility of that, of our numbers being a little bit lower than they actually are?
Well, Silas, it is definitely possible, and I would be more worried about that if I was seeing more hospital admissions and more ICU admissions, because we know that that is representative of the proportion that is out in the community. So, again, I've said this before, I don't want to have a false sense of security here, and so that is why it is important to look at the numbers as they evolve in the next week to 2 weeks, because, again, what we're seeing today is a snapshot from 2 weeks ago, basically. So, in in terms of moving forward and staying optimistic, cautiously optimistic, we do have to look at the numbers as they come in over the next week to 2 weeks. But certainly, it is obviously a good day when we're not announcing a new case.
Thank you. Silas, do you have a follow-up?
Yeah, one for the Premier this time. I know that you've spoken about long-term care homes today, but I'm curious if you think that there's anything that the federal government could be doing to better protect residents of long-term care homes.
We're going to be sharing some information in the coming days, but you know, a lot of work has been done from the both in Vitality and Horizon in actually training home care workers and our nursing home workers, so that they're using best practices, they're using the right equipment. So you know, I'm feeling good about the process that's been underway in terms of training, and in terms of what's being done in each nursing home. So I'm getting very good reports in that regard. I guess as again we go forward, we'll be looking if we need to do anything further, and I have updates that we'll be given the COVID committee, our leaders group, this tomorrow night, to go through the what's been done to date in nursing homes, so we can all understand, be on the same page of what's required, and if anything more, because we will do whatever is recommended or necessary in that regard.
Thank you, Mr. Brown. Colin McPhail, CBC.
Thank you, Bruce. This is a question for either Dr. Russell or the Premier. I'm wondering, will all hospitals, including the rural ones that almost lost overnight emergency room service earlier this year, be accepting and caring for COVID-19 patients?
So both RHAs, Vitality and Horizon, have been working together to look at the way that resources are going to be managed over the course of the pandemic. So I can't speak to the specific details around the decisions that have made around each and every hospital in the province, but I just can tell you that they are working collaboratively. We have 22 hospitals in the province, and so they have within their own pandemic plan that we are working together with the task force to really make sure that the most efficient and effective use of all the resources collectively is going to happen.
Thank you. Colin, do you have a follow-up?
Yeah, just a quick one for the Premier, again, following up on Silas's question. Is the Premier able to offer any specifics about what guidelines will be put in place here for nursing homes and long-term care homes?
Well, I think certainly, as I said, I want to review that, but there's been a lot of different standards that are put in place. I mean, for early on, we restricted any visitation of any kind. I mean, they're doing temperature sensing for all employees coming and going. They have protective equipment. They're wearing, I believe it's surgical masks as part of the routine now. And then the other training activities in terms of how to handle with patients, if there is an outbreak, how it's managed, and if there is any case. So I said I'm reviewing that. I know that Dr. Russell may want to speak to that in more detail than I can right now, but we are going to review that with our COVID team so that we see exactly what's being done in nursing homes, because obviously what we're seeing happening in Ontario and Quebec, we absolutely do not want to see anything like that here, and we're doing whatever is necessary to avoid any situation that would resemble that in any way.
Thank you, Mr. McPhail.